Hello, and thank you for listening to this. First, I want to talk about who and what Esperanza Sanctuary is. We're a 501c3 nonprofit farm sanctuary and community hub in Sky Valley, California. We are dedicated to creating lasting change at the intersection of human and animal well-being. We provide a safe haven for rescued and shelter-diverted farm animals while building programs that address food insecurity, sustainability, and public safety. Our work includes community composting and food waste diversion, regenerative agriculture, and accessible gardening spaces that bring fresh, healthy produce to a designated food desert. We also offer bilingual education, workshops, and skill building opportunities that range from sustainable living and wildlife conservation to animal care and behavior. Every project is designed to strengthen local resilience, connect people to the land, and ensure that no one is left behind because of income, language, or access barriers. Beyond the farm, Esperanza Sanctuary serves as a lifeline for people and pets in crisis. We provide sliding scale and grant-funded force-free training and behavior support to prevent shelter relinquishment in the first place and keep families together. Our programs are intentionally trauma-informed, recognizing that deep connection between human and animal welfare, and primarily decolonial. By partnering with schools, social services, and regional nonprofits, we can create closed-loop solutions where food resources and education circulate within the community instead of being lost to waste or inaccessible systems. In everything that we do, our mission remains clear: to build healthier, more compassionate Coachella Valley where people, animals, and the environment thrive together. Now, who I am. My name is Tabitha Davies. I am a dog trainer and behavior consultant, fear-free certified trainer, and shelter professional with over 2 decades of experience in animal welfare, behavior, and community outreach. I do consulting for daycares and boarding facilities on stress reduction and handling behavior issues. My degree program is in animal health and behavior from Unity Environmental University. I'm an AKC CGC evaluator, AKC ATT judge, AKC farm dog judge, class instructor and evaluator, pet dog ambassador, instructor and evaluator, certified trick dog instructor, and certified canine fitness instructor. My background spans human and veterinary medicine, as well as specialized training and behavior work with pigs and other livestock species. I'm the only provider through my work with Esperanzas in the Coachella Valley offering low-cost sliding scale grant and scholarship-based behavior services, including no-cost post-adoption training for adopters. I am on the steering committee for the My Dog is My Home Co-Sheltering Collaborative. I'm a former Association of Professional Dog Trainers DEI committee member, a former chair of the APDT, which is the Association of Professional Dog Trainers Education Committee, and previously led onboarding for members of the IAABC. Personally, I have also been on the Parent Community Council for Head Start. My career has been driven by the belief that human and animal wellness are deeply interconnected and that equitable, science-based, and fear-free approaches are essential for both public safety and animal welfare. Today, we're going to be talking about the 9 pillars of shelter reform that Riverside County is going to need to dig themselves out of this hole. It's a roadmap that takes proven best practices and applies them to Riverside County's unique challenges. Each district can be broken up into multiple smaller quadrants because we have different needs in different areas and amounts of people. In each of those sections, we have our own strengths and needs. By tailoring solutions to each quadrant while moving the county forward as a whole, we can create a humane and sustainable, as well as accountable system that works for people and animals. So we have urban and suburban areas that need clear open-door shelter policies so that residents are not turned away with strays. We need to focus on walk-in access and rapid intake triage. We have higher commuter population areas that need to partner with local businesses to set up drop-off points for quick intake locations. We have fast-growing suburbs that must prepare for increased pet ownership by ensuring areas such as Murrieta and Temecula facilities can handle volume without deferring intake out or elsewhere. We have vast rural areas that need mobile intake units and scheduled collection days for communities that are far from shelters because not everyone has access to transportation and rural areas don't get serviced by public transport. We need to implement an open intake guarantee and fund intake triage teams in every region, using county fleet resources to rotate mobile intake services into rural areas weekly. We need to partner with local services to make sure that our open intake is done responsibly and ethically, that we are transparent, and that we have medical and behavioral assessments on arrival. We do realize that behavioral cannot always be done the best way in a shelter environment, but we can at least understand if a dog is dealing with high amounts of stress or they are actually behaving truly aggressive. We can also create where areas for them to go to by adapting our shelter system to help mitigate some of that stress. We need to have targeted education for large breed and working dog households with behavior support before issues escalate. We need to work with community centers to host low-cost behavior workshops to prevent relinquishment returns. We need to have post-adoption consults for urban residents and high-energy breeds. We need to have culturally competent bilingual training resources in rural and agricultural communities. And a lot of people think bilingual is Spanish and English, when the reality is Riverside County has a very high population of speakers of Tagalog and speakers of Vietnamese. And so whether that is done by having one document in 2 languages with QR codes added to it for those who speak other languages to access the same resource, we need to make sure that it is available to anybody in any language. We should create a county-funded voucher system for behavior support redeemable with credentialed humane trainers to integrate post-adoption check-ins at 2 weeks, 3 months, and 6 months. We need to retrofit old kennel spaces with sound dampening visual barriers. We need to expand enrichment programs with volunteer-run sensory gardens, because when we are making sure that all of the biofeedback we're giving the animals is positive, that's going to help engage those natural innate behaviors and meet their needs. And that is going to help ensure that we are providing the public with the most adoptable animals, and the animals are showing themselves because, again, those needs are met. We need to work on teaching quiet kennel spaces, which is not done through punishment, but done through payouts. We can do that collectively through volunteer education. There should be training classes for the dog. So it's not just let's get out and go for a walk, but it's let's get out and go for a walk and practice our leash skills effectively. Develop shaded climate controlled kennels for desert conditions where needed. Train all shelter staff in fear-free sheltering. Certification should be a standard, and then having standardized enrichment protocols across all locations, for all species, I might add. Fear-free sheltering is a non-negotiable because we have amounts of stress that are coming in, and we have the animals who are stressed, and that leads to illness, it leads to injury, it leads to not showing well for adoptability. Stressed out dogs spread that stress to other dogs, then you get kennels of mass chaos. We need to implement mentorship programs, pairing senior and junior ACOs, integrate ASV low stress handling and onboarding for all new hires. So out the gate, they're on the same page. Providing additional safety handling and training for large livestock and rural animal cases. Mandate ASV aligned or ASV training for all staff and volunteers with quarterly skills refreshers. Partner with organizations such as the Shelter Playgroup Alliance to have them come out and provide education at each shelter site. Preventative medical care. So increasing intake exams within 24 hours for all animals. Partnering with local vet clinics for overflow of medical care. Establishing mobile vaccination events to reduce the intake of sick animals where things can be discussed on ways to keep them safe. Deploy pop-up triage units to remote communities. Adopt county-wide preventative care protocols, vaccination, parasite control, and hydration for every single intake within 24 hours. Changing out the lights to a motion detecting system, having blue lights be the main one in our kennel environments to reduce stress levels, diffusing things like Canine Calm by Earth Heart to help kind of transfer the amount of biofeedback going through the olfactory system, and having that be something that is actually calming. It kind of drowns out the smell of the other stressed out animals so that everybody can calm down a little easier. We need to host monthly, at minimum, free spay and neuter events in urban neighborhoods with high intake rates, integrate mobile spay and neuter clinics into community festivals and events, offering spay and neuter transport for residents without vehicles, funding satellite clinics in rural areas and tribal lands, launching county-run mobile spay and neuter fleets with bilingual outreach staff targeting high intake zip codes. Now on the reverse of this, getting into schools and educating students on the importance of spay and neuter, and taking the focus off just teaching the parents and also and the adult pet owners, but also teaching the children who are going to go out within their community and teaching them younger, hosting responsible dog ownership days, where even if those services aren't being provided, education on them is. Being able to connect with larger grant opportunity organizations to fund them, such as Petco Love and PetSmart, can help make a big difference on being able to give out collars and leashes and harnesses, treats, flea and tick prevention, things like that, to provide education at the same time in an event where someone's going to bring that dog, where we could also have training and behavior services. When I personally did a responsible pet ownership day for the first time, it was at the Pet Rescue Center in Coachella. Actually, it was the second time. The first time was in Morongo. And we've done those pretty much every year, except for the last 2 years, just because we have not had the staff support out here to do them. However, the amount of children that get education and information, families that go home with that and then spread it within their community is massive. And that's really where that education to the public lies, is educating the entire family. Ovary sparing spay, vasectomies, the alternatives to what a lot of cultural kind of dead stops are to getting certain types of procedures done, can be combated by providing them alternatives and places they can go for those alternatives. And some people are absolutely willing to find that extra financial amount or make the decision to determine that, nope, I'm going to go with the low cost spay and neuter because we can't make that happen. And I now see the validity in it. You open up those doors by not focusing on our traditional spay and neuter. We need to expand our pet food pantry partnerships with human food banks so that they are one-stop shops. Essentially, you're going to be able to target the people who are less likely to keep their animals because they can't afford to feed them by giving them the food where they're already going to get their family's food. We are not going to be looking at this as people of a certain socioeconomic status can have pets because everybody else shouldn't have them, because life changes in an instant and things can go really south and be really horrible in an instant. And people don't want to get rid of their family members knowing that the high likelihood of them going into the shelter means that they're going to die. We need to provide temporary fencing and pet supplies to families that are at risk of surrender. If we know that we have somebody who has goats that are constantly getting out and the shelter system cannot handle taking in 12 goats right now, then we need to figure out how we can get them fencing. We need to figure out how we can get people with dogs fencing. We need to talk to landlords about fixing the fences that they are responsible to maintain. Coordinate with homeowners associations and landlords to mediate pet policy issues, size restrictions, breed restrictions, supply working animal feed and vet vouchers to agricultural families, integrating pet retention support into county social services, create a unified intake diversion program that addresses the root cause of surrender instead of punishing people who are struggling and having that societal judgment happen, so that those animals either end up on the streets or they end up given away to the wrong home and they still end up cycling back through either one of those ways and into the shelter system. Anywhere that you see a logo throughout my presentation that is not an Esperanza Sanctuary logo, it is because these are the entities that are already doing this work, at least in the Coachella Valley area, or that is doing it on a more broad scale. We need to partner with domestic violence shelters to add pet-friendly spaces, coordinate with hospitals to offer boarding for patients in crisis and create a system for that, create a foster roster for short-term emergency care, establish co-sheltering facilities for unhoused and housing insecure residents and their pets. There is a large percentage of unhoused and housing insecure people who will not go into sheltering, who will not leave a domestic violence situation if it means that they have to leave their pets. Being able to fund a crisis boarding program through public and private partnerships using foster homes, kennels, and co-sheltering models is a necessity. It's not an optional. We need to push for pet-inclusive rental policies in urban developments. We need to work with property managers to reduce or eliminate breed bans. We need to offer landlord incentives for pet-friendly housing. We need to offer training support and behavior support for apartment facilities for low-income housing. Low-income housing should not come with an additional pet fee. We need to advocate for pet-friendly farm worker and seasonal housing. We need to create a county housing and pet policy task force, which could very easily be done with organizations that are already doing a ton of housing advocacy in our community, like Lift to Rise and CRLA, and shelter leadership to address housing insecurity for pet owners. Because until, my dog is my home has we've been pretty clear on this in our projects, but until housing is inclusive of pets the way that we are inclusive of children, we're going to have problems with shelter relinquishment because it's not pictured as a family unit when in reality, our pets are our family, and that's not changing anytime soon. When each district plays to its strengths and addresses its unique gaps, the county benefits as a whole. Local changes in intake access, behavior support, and pet retention directly reduce shelter crowding, and countywide alignment on humane standards, preventative care, and housing advocacy ensures that no community is left behind. This is how we are going to move from patchwork fixes to a functioning, compassionate, and efficient system. These are organizations that are already walking the walk. They're already doing the things that we need to do. So like in domestic violence situations, over 50% of survivors delay leaving because they cannot take their pets. Without pet-inclusive shelters, many victims are forced to choose between safety and family. Local and national programs like My Dog is My Home and Urban Resources Institute, PALS, and others have shown, which is the Pets, People and Animals Living Safely, by the way, have shown that housing people and pets together increases survivor safety, reduces trauma, and prevents pets from entering the already overburdened shelter systems. Riverside County needs at least one robust, trauma-informed, pet-inclusive domestic violence shelter in every district. The role of sliding scale and force-free training is huge on not only the shelter environment, but on the community impact. Accessible humane training keeps pets in their homes and out of shelters in a way that is ethical and responsible. Sliding scale and scholarship-based services, like we have here at Esperanza's, ensure that cost is never a barrier to behavior support. Force-free training is not just an ethical choice, it is a public safety necessity. And I'm going to add to this, we also we have a rescue partnership program where we work training and behavior education for staff and volunteers, for foster homes, and also for dogs that have been adopted for that post-adoption retention. It's a public safety necessity to have force-free training. It's not just ethical, it's a necessity. Aversive methods like shock, prong, choke, and intimidation have been proven, pain, fear, and intimidation, in peer-reviewed research for decades to increase fear, anxiety, and aggression and the risk of bites. There's never an excuse to utilize that in the shelter environment. There's going to be times where we have to engage in a way that we don't want to and force a dog into some sort of cooperative situation or forced compliance situation, such as medical care or catching them out in the field. But outside of that, we really don't. The American Veterinary Society of Animal Behavior and every major animal welfare body condemn, and this is global, by the way, not just in the US or Canada, it's global. They condemn aversives. In shelters, using aversives is a direct violation of humane welfare practices and re-traumatizes animals, especially those from abuse or domestic violence backgrounds. Training is a completely unregulated industry in the United States. I can wake up tomorrow, I can say, I'm a dog trainer, I can charge $77,000 to train their dog, and I can do whatever I want to them. So shelters have to set and enforce clear standards that ban aversive use in their systems entirely. We need to have co-located human and veterinary care. So when medical care for people and animals is offered in the same or in close proximity to each other through partnerships, like the Street Dog Coalition model or One Health clinics, families are more likely to seek care early, which prevents both human and animal health crises, which reduces strain on emergency systems and strengthens public health outcomes. Riverside County needs to create hubs that combine low-cost vet care and basic human medical services, as well as necessary social service connections to fill those massive accessibility gaps. This is about human wellness and animal wellness. They're directly interconnected. Our approach recognizes that people and animals do not live in silos. Their wellness is deeply interconnected. A dog trained with pain and intimidation becomes a public safety risk, especially when being adopted to the public through a shelter system. Just as a survivor without pet inclusive housing is at higher risk of returning to an unsafe situation. Humane treatment is a standard that benefits the entire community, preventing cycles of harm and building trust in public systems. What each district needs to do at a local level is establish pet inclusive DV shelter partnerships, recruit or develop sliding scale humane trainers, and partnering with existing human medical facilities to add that vet care access. If we have this as a countywide integration, we create uniform shelter policies that ban aversives in the shelter. We set clear behavior and welfare protocols, and we fund interconnected human and animal service hubs. It's not optional. If we want to reduce shelter overcrowding, we need to improve public safety and protect both human and animal survivors. Here is a list of references. You can pause, you can screenshot. The majority of them are open access. However, if you've come across one that has a paywall, find the author name, reach out to the author through their school or their university or whatever their business name is now, and ask them for access to their research. They are usually very good about sharing it. So let's talk about the numbers and put them into context. So in early 2025, RCDAS reports that intake is down 19%, live release up to about 81%, and the 1/3 drop in euthanasia. So the direction seems good. And it also mirrors national trends where intake has been drafting down since 2019. But the question is, how are these results achieved? We still do not see public reporting on the fate of diverted pets, community holds, finder fosters, or animals advised to stay out of the shelter. There's no 30, 60, 90-day outcomes, so it's impossible to know if we're solving problems or just moving numbers off the books. We also don't see transparent metrics for post-adoption support, behavior retention, domestic violence crisis, boarding capacity, or a countywide ban on aversive training, all of which directly drive public safety and long-term outcomes. We also need to have this information on the dogs that were flying out to other facilities. We do not have any metrics on them. So let's look at our peers. Maricopa sustained an above 90% live release rate with significant scale, proof that high performance is possible with capacity, flow, and prevention aligned. Pima highlights an extensive pet support lens and high save rates, yet continues wrestling with crowded systems and system flow issues. Austin had to close their intake and rely on outside boarding before adopting a 5-year plan, which is very clear signs of structural imbalance. Las Vegas just faced scrutiny for releasing large numbers of unsterilized fosters to adopt, a compliance and data quality red flag that the Riverside County Department of Animal Services is currently starting to repeat, because we're allowing unaltered animals to leave the shelter system. I do understand vet care impacts that, but we also need to understand that we have to do more to prevent that from happening in the first place. And it's not just about bringing vets in, it's about working with other vet clinics in our area and as a whole. If that means that we have to transport from one shelter to another to get them done and bring them back, then we might have to do that. The pattern in jurisdictions tied to Kristen Hassan, which is also known as the Outcomes for Pets and also known as Human Animal Support Services, or HAAS, and also known as Austin Pets Alive, their style of strategies is consistent, which is more emphasis on diversion and optics without equal investment in closed loop system supports. No housing help, force-free behavior services, co-located human vet care, DV inclusive crisis boarding, and there's no hard tracking of outcomes after the animal leaves the door. Riverside County cannot repeat the mistake that we are currently starting to right now. We need to have district level coverage of all 9 pillars, a countywide focus on transparent reporting on diverted and post-placement outcomes. And personally, I think there should also be a countywide ban on the use of aversives. That's how we're going to protect public safety, rebuild trust, and make those numbers actually mean something. If we look at the data that's in the lower right-hand corner of the screen here, you're going to see the counties that were directly impacted by Kristen Hassan and the issues that are still happening or the absolute disasters that are happening. And these are just 4. This is a very small selection. The questions that are still here, like how many pets are being diverted, community hold finder, what happened to them? What are our follow-ups? What are our post-adoption supports that are available? And no, little tiny DVDs that go out from a generic agency is not appropriate. What type of community closed loop systems do we have? We have none right now. And that needs to change in order for any of this to change. So we appreciate your attention and engagement with this video. We hope that this helps people understand fully the areas that our county needs to kind of jump in and address to create a system, because we cannot fix our animal sheltering system without fixing the deep connections that the people have that are causing them to have to lose ownership of their pets in the first place. We have to support people and pets directly. There is no separation of this. And if you need to reach out to us, our phone number, website, email address, we're located in Sky Valley, all right here. And Peep, the little cow in the corner, is Phoenix, and she's been with us for about 2 years. Thank you again for your time, and enjoy your day.